Okay, so two quick points I'll make here on use of clinical judgment. So the book, the DSM, and I think this is in more than one place in the book, that encourages that the manual be used only by people with proper clinical training. And it's probably more important to say than ever. You don't have to spend much time on any social media platform or even non other internet platforms to find no shortage of people without clinical training giving a lot of clinical advice as far as mental health and substance recovery and stuff like that is concerned. Not necessarily bad, but I think it is important that the training that you're doing, I guess let me put it this way, the training that you're doing is important. And going through this content, getting yourselves familiar with the DSM and the process of case formulation, of assessment and diagnosis and intervention planning, and doing that in a methodical way and understanding a deeper context of how to use the book and how to incorporate all those aspects that are well beyond just signs and symptoms of a disorder or an illness or an injury. So that's just a word on that. What you're doing, to me anyway, is very, very important. The other thing is the book also talks about, the authors in the book also discuss that diagnosis is not the determinant, the sole determinant, or even the sufficient determinant of whether someone or a couple or a family needs and has a right to intervention or treatment. We're assessing functioning in distress in addition to signs and symptoms and assessing for a diagnosis. All right, and I think that's really important because a lot of people will have significant health impact from stress and from social circumstances and from micro and macro issues that all may not necessarily add up to a mental disorder, as the DSM calls it, or a substance use disorder, as the DSM calls it. Sometimes people are engaging in self-destructive behaviors solely because they're trying to they're trying to find pain relief in their distress from current stuff, from past stuff, sometimes both simultaneously, micro stuff, macro stuff, lots of different social circumstances. So those can all be factors. Oftentimes, they are also happening concurrently with a behavioral health condition. So so that's just a little bit of extra context. And when I really this came back to me when I started teaching this course. Really prompted me to revisit this particular concept about, yes, we're assessing for diagnosis. Of course we are. And there's a lot of good reasons to do that. But ultimately, I think what we're trying to do is assess, and help people address their level of distress and their level of functioning, whether it's not, those levels aren't satisfactory to them, or there are circumstances around them, they're getting feedback from people that are important to them, or they're having social consequences that they don't want, even if they don't necessarily feel that their functioning or distress is poor. So this is something that really sticks with me and sort of helps guide how I interact with clients. So anyway, so that's just a few words about clinical judgment and the clinical significance criterion.